Welcome to our channel Examine the BDS. I am Dr. Dinesh. Today we are going to see about oral submucous fibrosis. It is a chronic progressive scarring disease that predominantly affects the people of Southeast Asian origin. Earlier it was called as atrophia idiopathica. Later in 1953, Joshi from Bombay redesignated the condition as oral submucous fibrosis. It is a precancerous condition. Now let's see its clinical features. Early symptoms include burning sensation in the mouth when consuming spicy food, appearance of blisters or ulcerations, and recurrent generalized inflammation of the oral mucosa. There may also be excessive salivation or dryness. We can also see petechiae in the oral cavity. This may be a vascular response to the external irritant like areca nut. In advanced OSMF, as the disease progresses, the oral mucosa becomes blanched and slightly opaque. Also, white fibrous bands appear. Buccal mucosa and lips may be affected at an early stage. Usually, the oral mucosa is involved symmetrically. Fibrous bands in the buccal mucosa run in vertical direction. The density of the fibrous deposit varies from a slight whitish area on the soft palate to a dense fibrosis causing fixation or deviation of the uvula and soft palate. Posteriorly, even the tonsils may get strangulated. The involvement of the tissues around the pterygomandibular raphe causes the varying degrees of difficulty in mouth opening. As the band thickens and the disease progresses, there is an inability to whistle or blow out a candle. The patient may also have difficulty in swallowing. This disease can be commonly seen in few states like Gujarat, Kerala, Andhra Pradesh, Tamil Nadu, and Maharashtra. The main etiological factor that results in oral submucous fibrosis is the habitual chewing of areca nut. Now let's go to the management section. The most important measure is the reduction or even elimination of the habit of areca nut chewing. At least in the early stages of oral submucous fibrosis, it could probably slow the progress of the disease. Different strategies have been applied towards oral submucous fibrosis. These include nutritional support, that is providing the patient with high protein and calorie diet along with vitamin B complex and other vitamins and minerals. This has an tissue maintenance and antioxidant activity. Next strategy is immunomodulatory drugs. Local and systemic application of glucocorticoids and placental extracts are highly effective. This reduces the inflammatory reaction, thereby preventing fibrosis by decreasing fibroblastic proliferation and deposition of collagen. Next is physiotherapy. This includes forceful mouth opening exercises and heat therapy. Heat has been commonly used and the results have been satisfactory. Next is local drug delivery. This we have intralesional corticosteroid and placental extract injections. It also includes hyaluronidase and collagenase injections. This helps in decreased collagen formation. You can also try a combined therapy that involves all the above mentioned. Finally, the surgical management involves the excision of the fibrous band. In most cases, there is more fibrosis after the surgery. The surgical option is not appreciated that much. So this topic ends here. Let's see today's bonus fact. A surgical procedure called selective amygdalohypocampectomy removes half of the brain's amygdala and with it the patient's sense of fear. I think this should be a solution to people with too much fear. I was just kidding. In the real world, people should face their fears repeatedly again and again so that they can overcome it. If you like this video, share and subscribe our channel. Thanks for watching.